Next, we have MatchMD talking about physician software. We have the CEO coming up to speak, Basil Bakri, and he will tell you all about MatchMD. And if you guys have more questions for Evolve, please visit them right outside the Innovation Theater. Yep, I will. No, I got it. We are good to go. Just hit the space bar.
Hello, everyone. Good afternoon. My name is Basil Bakri. I'm with MatchMD, president and CEO, actually co-founder. We started actually in 1999, where the doctors had the alphanumeric pagers, and they were, whenever you send a doctor that you are on call, you would call in and you get the 3 beeps, and then you leave a phone number. And at that time, a new technology came out, which are the flip pagers. Now we have cell phones, so just going through that fast forward, we have the technology that allows nurses and call centers to reach doctors in a secure fashion in a sandbox environment, where we provide smartphone applications for Android and for iPhones. Talking a little bit about why do we provide that thing. Because of the HIPAA rules, and I'm not sure if all of you know what HIPAA means, Health Insurance Portability and Accountability Act of 1996. So it has 5 titles. First one for the insurance portability, the second one for the fraud, and for the administrative simplification. And the third one is the tax-related. Title 4 is the group health plan, and Title 5 is the revenue offsets. Where we are in the sphere is under Title 2, administrative simplification, where there are 4 rules in there: the privacy, security, EDI, which electronic data interchange, identifiers. So if we fast forward through this, I'm going to try to use my time as fast as I can. So to whom does the HIPAA apply? To the payers, to the providers, to clearinghouses, and to business associates. Business associates, whenever you have to deal with patient-sensitive information, if you are outside of the 3 categories, you have to sign a business associate agreement. That happens, I'm sure a lot of you have heard about that. It became popular after that HIPAA rule. Now, what's going on in the HIPAA world? Look at these fines. Just this year, talking about the last one, Southwest Surgical Associates. The total number of fines so far is 1.6 million. So what's happening? Breaches are happening all over the country, whether it's physician practices, whether it's hospitals. With more cloud systems out there, the possibility of getting attacked is very high, and I'll show that in a little bit with numbers. The last breach that I have here in the presentation was with Southwest Surgical Associates. What happened is that I think a patient wanted access to her mother's PHI, and there was a failure of providing that in a timely manner. One of the regulations of HIPAA is you have to provide the patients with their access to their information, but you don't give them that unless they go through a security procedure. So in there was a fine. MatchMD, we're trying to stop the usage of SMS to send messages. Like what happened with the Kobe Bryant crash. Everybody heard about it, all the lawsuit, and how she won the lawsuit, his wife. Because police officers were at the scene, they saw the bodies, they took pictures, and they sent them. If you had to send them, to someone, it has to be a first responder. That first responder, you can't just send SMS. There's a possibility that will breach. Now we see a lot of advertisements for encrypted software. So you have to make sure you're using a compliance system just as MatchMD. Another set of, how does this impact the business? Security in general, let's talk about Verizon. When they bought Yahoo, they had a $350 million discount on the price of Yahoo because of that breach that we all heard about. Maersk, one of the biggest shipping companies, they paid $300 million because they had a ransomware attack. Equifax. What happened with Equifax? I got stolen. My identity got stolen with Equifax. It cost the CEO, CIO, and CSO their jobs. They all left the company. Aetna paid $115 million settlement from a cyber attack in 2015. The SEC reported 9 public companies paid $100 million in ransomware. So it's very important that you put protocols in your system to make sure the patient information or any other security-related information. We're not just talking about patient information. If you go to other industry, you're talking about social security number. You're talking about other information related to the privacy of the patient. These are the latest numbers. It's astonished me every time I look at this presentation. A new organization will fall victim to ransomware every 14 seconds and every 11 seconds in 2022. I mean, it's a huge number. In recent years, the ransomware from phishing emails increased 109%. Malicious coin mining, this is the latest thing. You know, there's the crypto jacking. It's the act of installing cryptocurrency software enslaves the device and tries to get bitcoins from the attacker. That increased by 450% this year. Again, when you hear about DOS, denial of service attacks, you know, you find a server in Russia, in China, or whatever country, you know, they come and they take over and they start sending your servers so much, you know, requests where it will kill the server from all the requests. That's a denial of service attack. What do we have now in our houses? There are 127 IoT, Internet of Things, devices connect to the internet every second. So the industry now is 1.7 trillion. Your phone, your car, your fridge, you know, everywhere you go in the house, you've got 5 Alexa devices, you know, or Ziggy. Now they changed Alexa to Ziggy. So, so you have 13 billion IoT sensors to be used in the consumer segment. Imagine that number. That's all points of attack if you don't put the right policies and procedures. The classical way of getting a ransomware is through email, where you get an email and you don't know who it is from, or even from trusted sources. You click on it, and then what happens, a worm will come in. You will not know what happened. You clicked, oh, this is not mine, you close it. But just by that click, you downloaded a worm into your system, and that worm will install itself on all the systems in your network, and the attack will start. What will happen, it will encrypt all the data on your system, and then you get a message saying, you have a ransom, you have to pay a ransom to decrypt the data. So for us, you know, to help these organizations, we're really becoming more of, you know, advisors to all the hospitals and the healthcare providers. And I'll talk a little bit about us going beyond that healthcare system. You have to identify who is responsible for doing what, when they need to do it, what they need to do, where they should do it, and why they should do it, and then put the procedures to how you should do it in a bold, you know, items. Our servers are SOC 2 certified. It comes from the financial sector for protecting Social Security, so we have that on our servers. Talking a little bit more about what MatchMD. So that's beyond putting the hospital in compliance. What we do, we offer hospitals the ability to get hold of their doctors through a web portal. That web portal will customize for each hospital. One of our biggest clients is Caring Health, and they do close to 400,000 messages per month through our system. We're very proud of that. One of the things that we do for the hospitals is the emergency medical treatment, EMTALA scheduling. That means that if you get a patient, no matter what whatever his medical symptom, you have to treat him at your facility. Or if you cannot treat him, you gotta provide a tool to route him to another facility that has that specialty. So MatchMD manages the scheduling for the emergency care facilities, providing they complete their schedules on time. An example is this. It's kind of hard to see, but on the top for Caring, these are about 12 or 13 facilities with all the specialties on the left. So for each specialty, you know where to click to find who's the doctor on call. So in here, let's say you're clicking, you need to find a cardiologist on Soin. So you would click the box Soin Cardiology. You get the doctor who's on call at this minute, and you can get hold of him in order to provide care. Other classical things that we do, we have the after hours service. So what happens for the practices? At 5 o'clock when they shut down, we give them a phone number. They route their phone number from their office to our call center. Our operators will recognize that number if it rings and answer for the doctor, take that message and send it to them on a secure message through the MatchMD app. So that's what we provide, and I hope I didn't take more of my time. Any questions you have for our system? All right, great. Go ahead. Yeah. Yeah, it's amazing the amount of the growth that we've had. We're in 12 states and we're expanding. So hopefully we're going to get more of the local hospital networks in the local area. Scott Jones and myself were at the booth outside as you see us. People think we're the registration desk. We got the nice location. Thank you so much for organizing this effort. Have a great one.